Welcome back to the podcast series hosted by the World Society for Pediatric Infectious Diseases. I am Alicia Chang, a pediatric infectious diseases specialist based in Guatemala City. Today you will be the host for this episode. Today we will explore the best way to manage dengue in low-resource settings. Let us analyze the key strategies for dengue control in low- and middle-income countries, the challenges and the related solutions concerning access to vaccines and effective public health responses, in order to share their ideas and experience. I am pleased to welcome the presence of Dr. Esteben Ortiz-Prado. Dr. Esteben Ortiz-Prado is a medical doctor by profession, a full-time scientist, a professor, and an avid science communicator. He is the PI at the University of the Americas in Quito, Ecuador. Welcome, Dr. Esteben Ortiz-Prado.
Thank you very much, dear Alicia. It's a pleasure to greet you and all here for the invitation.
Esteben, let's begin with the first part of the interview, and let's talk a bit about dengue control strategies. Then, in settings with limited resources, which key strategies do you think have been most effective in mitigating outbreaks? And if there is any specific example from Latin America that you can recall that perhaps has been particularly successful.
Well, really, in contexts such as Latin American countries in general, there are substantial inequities in access to healthcare, in education, and obviously, in basic services. The presence of mosquitoes is directly related to the accumulation of rainwater or standing water in places where mosquitoes can proliferate, and of course, vector management aimed at preventing their growth. Obviously, it is one of the most effective approaches. We have, traversed across the Latin American region by employing a wide and varied spectrum of strategies, ranging from the simplest ones, such as fumigation in rural or peri-urban zones, across many contexts, to more elaborate and diverse forms. Let us call the biotechnological ones biocontrol, based on, for example, obacha, which is one of the best-known methods by which the mosquito has been brought under control. But between these two approaches, there are obviously some successful models, aren't there indeed? We have managed to control and reduce breeding sites through the use of mosquito traps. Obviously, there are examples, even very close ones, nearer to you than to me, in terms of Central America, Mexico, and Nicaragua, which have had some trials based on, obviously, the intensive use of pesticides as well. With this famous green path that has yielded interesting, cost-effective results, which is, of course, the most important, biocontrol. Likewise in Brazil, there are reports from Niterói that describe reductions of more than 60% in the incidence of new dengue cases, including during dengue outbreak periods, as has been noted by researchers. And this did not only benefit dengue, for example, through the Wolbachia project, but it has also gone hand in hand with chikungunya and Zika. And here, slightly further in the direction of Ecuador, let's call it that. There are some interesting projects in Machala, say along the Ecuadorian coast, which is a region where dengue has long been a concern. There have been successful models with prioritization of resources for routine home visits, door-to-door epidemiological surveillance, where health workers go to assess how the person lives in their home. Once they've identified these particular zones, they begin with targeted strategies, and there's a great deal to discuss in relation to dengue, and obviously the control within the region, but I think these are indeed among the main ideas.
Yes, I think that in our countries in Central America, dengue used to be a disease that tended to be found more often in the warmer, more coastal parts of the country. And there really is dengue right here and right this moment, across many places. You can see it anywhere across our country, in both urban areas and in rural areas, wherever you go, at all times. It's present in rural areas as well. That is, the mosquito is there, isn't it, as we can clearly see? It's no longer something that's simply a rather small local issue affecting public health. Perhaps we can regard it as something more widespread. And this is a little of what we were talking about earlier. Some time ago about climate change, wasn't it? It certainly seemed that at least in Guatemala, in the city, the weather was a touch milder, and during certain seasons of the year for at least half of each year. And now it is genuinely very warm indeed. And I think we have all suffered the blows of global warming. And I think that this also favors the proliferation of this kind of vector, right?
If you are aware that in Ecuador, where I reside, there also exists a very particular experience. The first dengue case in populations living at elevations above a certain height occurred a couple of years ago, indeed. That is, we live in Quito. But if you will, the Quito Metropolitan District is in fact much larger than most people might think, and it includes zones that are somewhat lower and zones that are somewhat higher across the landscape. And in one of the lower zones, where we have a bit of montane forest and also cloud forest, there the mosquito that transmits dengue was found, and a dengue case was reported for nearby groups. So, what does this mean for us all? That, as you rightly say, climate change is pushing the vector to find new places that earlier were unlikely. So it is expanding from a place where it used to be very common to find it. And although it remained quite restricted, it is now looking for these new niches because of climate change. For me, and perhaps for you as well, as you've said, age-wise, I would call it around 40 years old, give or take, and for what it's worth. Like in my own city, for example, I have lived 20 to 25 years without wildfires because the climate consistently granted you a window of rain, a period when moisture filled the air and the land could recover before flames could take hold, almost always in the seasons when it would rain now. 2, 3, or 4 years ago, we had exceptionally hot summers with droughts to such degree that there have been grave wildfires. So climate change is definitely another factor that affects the region, right?
This is definitive. They were then realizing that this is a disease that truly affects all Latin Americans, and that is precisely why this has become a topic we really wanted to cover in this particular podcast. And we wanted, quite specifically, to do it in Spanish, because we believe we have had serious problems with dengue. I would say that the last 2 years have become a problem. Very difficult indeed. One of the things I think is holding us back from tightening control of outbreaks is the lack of access to vaccines. There are numerous significant challenges in the vast majority of Latin American countries. Honestly, the vaccine simply isn't available in the way you might picture it. In terms of vaccines, do you think it could become a little more accessible in the future?
Well, that is a topic which, obviously, concerns access to vaccines. I have explored it several times, and we have even published around 6 or 7 scholarly papers on the productive capacities of vaccines in the region, and also access to vaccines in relation to costs. And we are a region where tropical diseases are present, but the patents for vaccines against those tropical diseases usually come from the global north. So it is a topic which, well, has a great deal of historical context for several important reasons. Nevertheless, the issue of vaccine access obviously has a fundamental constraint, namely, the limited resources that are available. There have been several, let's say, positive experiences since TAC 003 was rolled out as this vaccine, and it is currently being given priority, especially during pandemics. Well, unsurprisingly, access recommendations come in staged phases. That is to say, there remains data lacking on post-marketing effectiveness, and obviously, although back in 2005, the Pan American Health Organization vigorously pushed several collaborations with local producers, because Brazil, for instance, is a genuine powerhouse in the production of biotechnology and biologics for vaccines at present. Well, obviously, the prioritization of this vaccine that contains the serotype, let us suppose it is an emergent one, may well be one of the ways of breaking down the barriers to access that obviously exist. In the Latin American context, to be honest, there has not really been much dissemination about the virtues of the dengue vaccine that is already available in some contexts. And what tends to arrive more quickly, for instance, is negative news, which is often the case in public discourse. For example, what we experience as a scientific community with Wolbachia and the related problems, in the broader context of ongoing global health challenges, is, to some extent, the increase in the risk of developing severe dengue in certain populations. And pushed by the COVID-19 pandemic, many people may have doubts that they did not have before getting vaccinated in today's world. That is to say, unfortunately, there has arisen what we have called the vaccine paradox since COVID-19. People, even during the pandemic, rushed to get vaccinated, and when the pandemic ended, people seem to have turned their backs on vaccination, not necessarily in Latin America as they do in other parts of the world and other latitudes. But there is, to some extent, resistance and hesitation when it comes to vaccines against any disease, and even more so for a dengue vaccine, which currently still carries the label that it is still under study, doesn't it? And that, in turn, is a topic that people don't like much because, as they don't understand, they have a bit of hesitation about it.
Yes, I definitely think so. Well, we are dealing with vaccines that have been on the market for many years now. For instance, the vaccines for measles, rubella, and mumps, which we've used for many years indeed. I know that our vaccination coverage is very low indeed, and there have been numerous measles outbreaks in Mexico near us. In Guatemala, we have not documented a single symptomatic case yet. But if we know that there is ongoing circulation of the virus, and yes, there is a lot of pertussis around, then when people are thinking about new vaccines, I believe that if they are really having genuine difficulty accepting the idea of a brand new vaccine, and in fact, although you, say it in Latin America, they still tend to be somewhat guided by the doctor's advice, and perhaps the reluctance isn't as high as in other countries, we are experiencing a somewhat greater degree of difficulty. Certainly more than what I was saying about 10 years ago. Isn't that so? That is to say, we really must devote a great deal more time to explaining to people what the benefits are, and of course also to outlining the possible adverse events that may be linked with the vaccine. However, if there is a lot of distrust, even with this dengue vaccine, I believe it is very necessary, indeed very necessary. All vaccines are essential, but I believe the dengue vaccine in our countries could make a substantial difference, indeed, for us all. Then, hopefully in the not-too-distant future, we might be able to overcome these barriers to ensuring that the supply remains good, so that people, and we as doctors too, can clearly and simply convey a straightforward message about exactly how vaccines work to all audiences, and that people accept it in a really significantly more positive way. Don't they?
And yes, that was the point I was making. For example, there are positive experiences in targeted public health campaigns, for example, with the Takeda vaccine, which has been implemented in certain population groups. But it shouldn't be rolled out on a mass scale in all countries. But for instance, Brazil, being a country with more than 250 million inhabitants, obviously is very attractive for this kind of work and, moreover, very tropical across almost its entire extent, making it highly attractive for such projects where the aim was to identify the level of protection the vaccine could provide. In this case, there is data on, shall we say, seroconversion indeed, and the protection actually achieved, which is to say, namely, the vaccine that was deployed across the population groups, specifically, including the adolescents themselves, where more than 80% of people had protection against serotypes 1 and 2, and a reduction in hospitalizations, and a reduction in the risk of morbidity and mortality. And this, together with other strategies, for example, concerning the use of mosquito nets, which in Ecuador we call toldo, alongside vector control, yields positive effects, and, of course, we can reduce the risk of death as well. Therefore, I am certainly on your side now when I consider that the region needs to urgently acquire the vaccine and to implement more projects. What is the problem in Ecuador? In Ecuador, exactly. Not in Ecuador, and perhaps in other small countries, perhaps like Bolivia, and perhaps like the Central American countries, is that we are a small population and the population at greatest risk of developing dengue is more remote than the rest of the population. For example, the major cities in Ecuador have no dengue cases, and unlike smaller cities, that makes access to dengue vaccine deployment projects or programs relating to its deployment even more difficult. But we are positive. We look favorably on TAC 003 results. And obviously, we believe that soon we will have programs in Ecuador where the use of this kind of prevention is established, for the population at risk worldwide and those most in need. And of course, let us hope that governments, through even the revolving fund, via coordination with PAHO, WHO, and Gavi, can provide access that is much cheaper. Because one of the main, and perhaps the greatest problems, is the lack of financial resources right across the region for those who need it most.
Yes, I understand that this is a vaccine that is indeed somewhat pricey, and even when included in this kind of revolving fund arrangement. I imagine it would help reduce the cost, but even so, it would still fall among vaccines that are a little more expensive. Wouldn't you agree? How important do you think it is, in your view? What is it in our professional capacity as doctors and scientists to also address this issue of vaccine accessibility, with other kinds of institutions suddenly stepping in, such as the Ministry of Health, the National Immunization Commissions, and some politicians suddenly becoming involved, so that we can move forward a little faster, perhaps?
Yes. Well, you've said that very well, haven't you? I believe that the vision within a health system is the articulation that all stakeholders can have. And among these players in the health system sits the rector, whom I take to be the same for all the countries in the region. In other words, a Ministry of Health that coordinates or governs all sublevels, whether public or private institutions. But to this, so to speak, the rectorate, we must also add actors such as the academy and other academic actors within the system. It is fundamental that researchers, doctors, and teachers join us in these kinds of campaigns to try to speed up the process. For instance, something that, from my viewpoint, broke many paradigms was, again, that, and of course I always use the metaphor or the experience of the COVID-19 pandemic, because it gave those of us who work in public health and epidemiology the opportunity to live in real time, so we can respond faster to future health threats and strengthen the science guiding us, something that gives us experience to help us make informed decisions that matter in everyday life. And for example, in Ecuador, I would like to put on the table a clear and practical example of articulation. Truly, in the United States, they vaccinated on the day when the greatest number of vaccines were given, 5 million in one day. And in Ecuador, on a single day, they vaccinated 450,000 people. But if you compare by population, the vaccination rate in a single day was almost twice as high in Ecuador as it was in a country like the United States. What did we do in Ecuador? Something that, to me, broke paradigms by uniting public and private institutions with the business sector. So the companies joined in to vaccinate their workers all together. Universities joined us to train students so that they could become vaccinators. And in just a single day, 500 vaccination facilities were deployed. Then, of course, indeed, when you run a massive campaign, obviously against a disease like COVID-19, this multi-sectoral collaboration has indeed yielded results. So I believe that in dengue control, we must break these paradigms again and include not only the Ministry of Health and the people in charge of epidemiological surveillance, but also the stakeholders once more. For example, in my case, I truly devote a lot to medical communication. Although I am a scientist, for a quarter of my time I try to communicate with the general public today. And much of the misinformation stems from the fact that my medical colleagues are very busy treating patients, and anti-vaxxers are crowding us out. Because anti-vaxxers, by contrast, have the time, sometimes the resources, and even have the creativity to flood us with videos of cartoons and other vaccine-related content today. Then, while they release 20 anti-vaccine videos, people like you and me draw from a video. So today, in the world on social media, I believe that the health influencers community must come together to position this issue alongside academia, industry, and the mass media, which still have an important role. Community radio and stations can help vaccines regain a prominent role again. And I must be honest, in South America and Latin America, I believe that if it is free, people will still say, well, if it's offered to me at no cost, I'll take it. However, of course, we are seeing a growing number of people who oppose vaccination. And clearly with dengue, we have not yet experienced it much because it remains confined to certain areas of the country or region. But, well, We are already starting to see that people do not want to get vaccinated against anything at all, ever again. And this is borne out quite clearly by the data. Ecuador reported 35 deaths due to whooping cough in the year 2025 and had not recorded a single death in the last 25 long years. That is to say, take a look. Something's going on, and clearly it's linked to the lack of access to vaccines or some other issue from production, and the shortage of vaccines reaching our region as well, isn't it?
Yes, I think you've touched on a very important topic indeed. Well, few important points. The role of forming strategic alliances when the idea of vaccinating isn't being considered, especially for vaccinations that must roll out on a larger scale and faster. Isn't that right, don't you? But even when considering the dengue context, I think that example you gave about the pandemic actually works very well. It works quite well, doesn't it? Because in reality, it's a way in which, if there are many different actors involved, people have far fewer doubts about whether exactly if all these people are on the same task together. Let's take a look at this. It has to be something good, because there are far too many players involved. So it seems as though they're not thinking, is this doctor trying to induce me to do something? Right? Here you have players from all parts of the world. Doesn't that seem right? From the community, there are businesses. There are even people from the government, figures from various religious groups and similar groups getting involved. I think that's exactly where we can suddenly be more critical. And the other thing that I think is really important that you say is our involvement in social networks, which really is very, very small indeed. Precisely because if there is a stigma, I think apart from the fact that we do not have much time, it's true, but there is also a stigma, I think, that we somehow fail to reconcile this persona of the serious doctor with this situation of being inside the social network, isn't it? Then, since you have to act and you have to go about doing it, right? Well, it costs a little, I suppose. I think it's a set of skills that little by little can be learned and developed, but which is clearly and undeniably very important, because as you say, they are gaining us a huge amount of ground, because people nowadays tend to rely heavily on social networks as their main sources of information, i.e., they do not even consult properly, nor turn to Google. No, they go straight to TikTok, they go straight to Instagram. In any case, and if we still do not have the capacity to communicate effectively through their channels, if we fall a little behind, I think, as doctors. And society as a whole isn't making any meaningful, tangible progress, because we truly, honestly can't communicate in a way that is accessible to everyone, right?
Yes, not exactly. Okay, I agree with that, sure. I honestly think that doctors in general are poor communicators. That is to say, they didn't teach us at university about communication as a cross-cutting subject. And you see, I've changed, and I say, I've changed because I've had 2 television programs during the pandemic. I had a world record. I think it's global. Each day I did a COVID program, 900 in total, and 2 radio programs teaching classes. So you learn by doing, and of course, talking about health communication is a little easier for me now, but the process wasn't simple. And I think that's when global health communication in epidemiology has a fundamental role. That is to say, if we convey clearly about the doctor in the consulting room saving lives, who is a genius who knows the subject matter perfectly, but who, by contrast, has difficulty translating technical language into everyday speech, because obviously it does not reach the patient. And if, for whatever reason, it does not reach the patient, indeed, there is even data showing that medical doctors with larger social networks have even more patients, not necessarily because they are better doctors, but because they are more widely known. And that is where the problem lies too, because as with everything there in the Lord's vineyard, there are medical colleagues who are anti-science. And that is a topic that has been experienced in other contexts here in the country, especially when the pandemic struck, and doctors were encouraged to publicly back the use, for example, of chlorine dioxide or hydroxychloroquine. So if a doctor endorses that, it undermines all your work to promote a topic, because one doctor says one thing and another says something else. From that point, the best practice in the Americas should be evidence-based, and we must remain constantly and responsibly vigilant in promoting that kind of knowledge among the general population. No?
Indeed, this is something we always discuss within the medical community across several societies around the world. And in Guatemala, I always tell my dear colleagues, man, there is nothing more damaging to vaccination than a doctor coming out and saying that the vaccine does not work, that it is not good, and that you should not have it, because people in our countries still hold doctors in very high authority. That is to say, whether you like it or not, you do not have a university degree, which in our countries is hard for people to reach that level of education. So, the person still respects what the doctor says, and yet a doctor came out saying something like that. Truly, this is something that indeed can seriously wreck a great deal of the work currently being undertaken to try to encourage people to take appropriate preventive measures, to get them vaccinated, to seek prevention, right? And to finish up, Esteben, because we really do not want to take up too much of your time, and also, as a communicator, you know these short video clips need to be somewhat shorter. Otherwise, people simply don't finish listening to them. What pearls of wisdom could you share with early career doctors who are working in settings that are severely resource-constrained, facing ongoing dengue fever outbreaks and the persistent lack of access to vaccines? What can they do in their surroundings to help their patients? Whether by communicating, reassuring them, or by trying to convey not only hopeful messages, but also that there is indeed a practical way to prevent illness, and that if they notice any symptoms, they should seek care early and without delay, in a respectful manner. Do you agree?
Well, a few pearls of wisdom for the people who watch us, who will obviously see specialists in infectious diseases, for whom perhaps the briefing is more superficial than they would expect because this is a matter of communicating to society. And for those in rural practice, the doctors working out in the field, I therefore offer them several practical tips for the public. First of all, back to the basics, eh? It is important to say that we must understand that primordial prevention indeed works. What does primordial prevention mean? Well, obviously, of course, let's try to talk to every patient we see about the importance of drinking water, of clean water, of sewerage, of disposing of rubbish where it belongs, and so on. That is a baseline that already runs cross-cutting through any typical consultation. Second point, I would strongly advise you to tell patients, depending on the area where they live. 1. Again, let us not forget the importance of prevention indeed. Emphasize that water containers pose a danger. That is, if you live in an area where vectors are present, if you have bottles, cans, or any container that could allow rainwater to accumulate, rainwater in particular, it could be deadly for you or for your children because dengue can be fatal. Third, dengue is preventable. That is, it is preventable because we can avoid mosquito bites. And obviously, one of the best ways is let us use mosquito nets. Let us use repellents, and also use, in this specific case, the famous insecticides. Fourth, there is a vaccine that can be rolled out, particularly in areas where there is presently a high risk of transmission for public health. Then we are the agents of change. Let us ask our health authorities to begin a rollout in high transmission areas of the available vaccine, despite the difficulties we face for the most vulnerable. But above all, that people understand that the vaccine is available for the common good. I think an additional important aspect to understand is that dengue can become a serious and potentially deadly disease, and that obviously, although we have had dengue at some point in the past, it is being seen that the circulating serotypes sometimes change over time. So you may have developed immunity, and let's say it is active, based on a serotype in your locality. But the globalized world changes so much that a mosquito can board the same plane you did, and you acquire a new serotype that infects you. Today you're in Colombia, tomorrow in Brazil, the day after you head to India, and then you return to Ecuador. So we need to understand that the different serotypes are circulating, and that although they are well mapped in some places, they are not in others. And the best possible approach is for everyone to have immunity, either through vaccination or through prevention. These would be the two main mechanisms indeed. And finally, also the power of communication. I always tell my public health students, I have lived in real time, truly. The positive effect it has on public policies by changing people's mindsets for the better. I don't know if you remember, but when I was a child, back then, there wasn't an obligation to wear a seatbelt in Ecuador. That really happened 5 years ago. Back then, cars didn't even come with seatbelts. And when the compulsory age was introduced, I clearly remember seeing my uncle and my aunt, who, whenever they spotted a police officer, would fasten their belts. When the officer walked away, they would unbuckle them. And today, after 30 years, I see my children and all kids climbing into a car and fastening their belts without asking. They simply know it's part of the routine. So what exactly am I trying to get at with this then? With that communication, prevention, and health promotion do actually work. We live in a time when the world moves so fast that sometimes we fail to realize the advances we have made. But we have made progress. We have made progress against dengue. People are dying a lot less. Yet, we can do a lot more. There are a number of emerging diseases that are always stalking us day by day, and there are diseases we know, such as dengue. If we already know it, then let us not allow it to advance through these measures of communication, effective treatment, and consistent following of protocols, and of course, fully engage with the community through clear messages, right? So I think these could be points worth noting. There are many more aspects to dengue, as well as many other vector-borne diseases that are important to understand. They are a world apart. One could spend hours discussing different vector-borne diseases, but dengue is certainly a deadly and also preventable disease. That is something people have to understand. We couldn't let people die from dengue, knowing there's a way to prevent the disease. Right then?
Thank you very much indeed. Esteben, I think this is an excellent, very effective way to determine this podcast, because sometimes those doctors who work in those centers and health posts, feel a bit overwhelmed today indeed, really. Not for the person who says, well, what can I do? What can I do? And many people who become ill come along and say, well, I don't have a vaccine at this moment, which is in my hands. And I think the message you're giving us right now, how do you say it? Back to the basics is essential. And really, these are strategies that work very well, very well. And they are absolutely essential. And through them, you can do a substantial amount of good for your community. Even if you do not yet have that vaccine in your hands, you can recommend it, and you can begin to introduce the topic slowly. And there are all the strategies for preventing the bite of the mosquito you are talking about, which can also greatly prevent the disease. Right? Then there are many things we can do together. It's simply, as you say, to keep working on our communication for our mutual understanding, and really sure, yes, to keep that going between us. Over time, things gradually change. What happens is that sometimes it takes a little time with the seatbelt matter, that kind of thing. But if in the end we learn it and now we climb into the car and we're not wearing the seatbelt, mate, we feel, perhaps, that something's really missing, don't we? So, eventually, I think it will be the same with the dengue vaccine and all vaccines. We'll feel that it's like a seatbelt that not all of us have to wear, right?
That's absolutely right, I agree. And I always tell people who opposed certain vaccines that, again, recalling the pandemic's negative examples, people say, look, you see, even with the vaccine, their sickness was the exact same. I know people who were vaccinated and still died. And I told them the message in a very casual way. Look, it's like wearing a seatbelt. It doesn't guarantee that you won't be involved in a crash, but it reduces the odds of dying in an accident. Or worse still, if you're on a boat on a cruise with 1,000 people and all 1,000 wear a life jacket, perhaps one of those 1,000, even with a seatbelt, could have died. Drowning with the life jacket on, someone could have died, even though the life jacket was on. But the other 999 people were saved. What would have happened if none of those 1,000 people had a life jacket? Well, surely 900 would have died. Therefore, vaccines are a seatbelt for your health and well-being. They are a life jacket that dramatically reduces the chances of you getting ill or dying and protecting you across a wide range of illnesses. And with that, it's more than enough. There is no vaccine that is 100% effective for all diseases, because otherwise we would not have illnesses. Science is moving forward in that direction, but as we are still getting there today, we must use the resources we already have. Vaccines are safe. Vaccines have been studied for decades, and technology is utterly irreplicable in different contexts. So if you have the opportunity to be vaccinated against dengue in your communities, it means that one of the vaccines available has already arrived there. And you can do so because it is the most effective means of protecting yourself. We all truly want to live longer. Life expectancy should rise in every region of the world. And so, if we want to live longer, we have to live better and healthier. So everyone, let us focus on prevention, promote health, because it is the only thing that will cut the odds of illness and premature death, right?
Thank you very much indeed for your time, Esteben. We really appreciate you spending all these minutes with us today. And with this, we conclude today's recording now.
No, thank you. Thank you, Alicia, again.
And this ends today's episode. A special thank you to Dr. Esteben Ortiz-Prado for his time and valuable input. To locate a wide range of resources and educational material, you can easily visit the World Society of Pediatric Infectious Diseases worldwide online learning portal on its official website today. Its comprehensive information center devoted to pediatric infectious diseases. Whether you are traveling to or from work each day, you are collecting the little ones from school. Thank you all for listening to the World Society of Pediatric Infectology podcast. Please make sure you are subscribed to your favorite podcast platform so you don't miss any episodes right away. Please kindly share the podcast with your colleagues and kindly leave us a thoughtful review. Be sure to tune in next time, please.